Hello, my name is Ron Kelly. I'm the president and CEO of Epworth Villa, and it is my privilege to introduce to you a special guest, one of our medical directors here at Epworth, Dr. Tomás Owens. Welcome, Dr. Owens.
Well, thank you very much. Hello, everyone. Like Mr. Kelly had just mentioned, I'm Tomás Owens. I'm a physician. I am trained in family medicine at the University of Oklahoma, and then I have further training in geriatric medicine, which I did at the Mayo Clinic, prolonged fellowship there in geriatric medicine. And I've been back to the state now since, lived here 32 years in the Oklahoma City metro area. And I've been a medical director here at Epworth Villa since 2001. So 19 years now and a few more days. It's important that we are prepared for the upcoming events on COVID-19, and I think we have been. And I want to tell you a little bit about the vaccination, the upcoming vaccination.
You know, before we jump into that, I was hoping that we could hear more about what you are doing currently, because I think folks would be really interested in that.
Oh, thank you for asking. I'm still a full scope family physician, and in my other capacity, I direct a residency program at Integris Baptist Medical Center. There, I actually cover the inpatient units and have been actively seeing patients with COVID-19 disease at both the clinics and the hospital at Integris Baptist. On an average day that I round, we have around 20 patients, of which on the average half have been COVID-19 affected patients. The hospital, of course, in total has 100 patients, and we've been involved with a lot of the strategies regarding that as a member of the officer staff, and on the plans on how to address the needs and how to go further from now.
Well, thank you for your service in helping those that have been impacted by this disease. I'm sure that has been a great burden for you and many others, and we're so grateful for our frontline responders that have put themselves at great risk in order to serve others. So God bless you for that. And we're, again, privileged to have you and your perspective enlightening us as we talk about these vaccinations and other kind of COVID-related questions that folks might have. So let's jump right into it. I mean, first of all, what can you just tell us about these vaccines? I mean, first, I think the main question that people probably have, you know, should I get one when they come out? Will it be safe? What can you tell us about that?
That's absolutely, you should get one. In my mind, there's no question about that. But the basis for that is to understand the process. Essentially, we've been working on a number of these different types of vaccines over the last very many years. And what occurred is that with the Warp Speed project, this has been really expedited. Funds were allocated for more research scientists, for more laboratories. And now we've been able to finesse, if you wish, the progress on these different types of vaccines and speed them up. They still have to be approved by the FDA, have gone to every one of the FDA requirements, not unlike other vaccines. And the FDA indeed will meet for final approval after having followed the developments on December 8th, 2020, here in just a few days. The vaccines already have been tested at the different stages, stage 1, stage 2, and stage 3, and they've proven to be very safe. Additionally, I think the question one needs to raise in one's mind is if there was, and there are of course some side effects and issues, are those more serious than getting the disease? And let me tell you, from being in the hospital a lot in these last several months, COVID is nothing to sneeze at, pun intended. It's a really serious disease. And granted, it varies per person. You have no idea who that person you are going to be. So I certainly rather take a shot anytime than get the disease.
So, what are some of the side effects that will be common that they've found in these trials?
Well, the most common is it's more of an annoyance. It's going to hurt in your arm when you get it. That usually lasts just a few days. A few patients would mount a response so good that it would feel like you're having a little shaking, a little muscle soreness. That's not equivalent to getting the disease. That is not getting the problem. That is actually your immune system reacting so strongly that you get those muscle aches and soreness. That's going to happen in 3 to 5% of people, very likely. We have not seen very serious side effects, again, in any of the trials that have been reported. And we'll know a little more, of course, after the FDA approves it.
So, what is the effectiveness? We hear like these percentages of effectiveness. Can you put that in terms that we can understand?
Oh, absolutely. Typically, the way we measure this is people get exposed to a problem, and you compare the rates of infection in people that were not immunized versus the people that were immunized. And to give you an idea, we do have a number of vaccines that have high 90s that we give to children. But the one we give to adults the most commonly is the influenza vaccine. And we consider a good year a year that the influenza vaccine prevents the disease in 70% of the people exposed. And an average year is more like 55, and a bad year is like 40%. These vaccines are all in the 94.5 to 95.1% coverage rate, meaning that if you contact somebody with the disease, you have a 95% chance that you will not get it. That really is extraordinary. And again, the main reason for that is they're using new technologies, well, new meaning of the last 10 years, that were expedited quite intently with the Warp Speed project.
So those new technologies have been instrumental in allowing this to be developed much more quickly, because early on we were told this could take years, in some estimations. So should I be worried that this has come together so quickly? Has it been rushed? Have there been any corners that have been cut?
That is an excellent question, and it's every person in America should have that thought. Is it possible this went too quickly? From looking at the data from the medical perspective, and as I told you earlier, I'm briefed about this every day because of my situation of working at a hospital in addition to working at Epworth. And I've been updating you, Mr. Kelly, as we've gone through. They are really going through every one step. The stages are very standard. Stage 1 is, does it hurt people? The stage 2 is, does it even work? And then stage 3 is, does it do the job at a level that is acceptable for a vaccination? They're going through each one of them in a very well planned way, and they've been actually going through all the steps as they should have. What's amazing on this one is just the amount of manpower that was put into getting this thing rolling, more than anything else. So I feel really confident that the steps have been taken properly and that this vaccine is safe.
So, vaccinations have sort of had some controversy over the years. There are folks that have been actually putting out, I would say, misinformation about vaccinations, and even, conspiracy theories and whatnot. What are the most common misconception or maybe myths that you've heard that you would like to address?
Well, there's a number of things that come up when something like this happens. When you're in disagreement with vaccination use, that falls into a number of different categories. The three most common ones are, you just feel that nature has given us these processes and we're supposed to get the contagion and develop the disease and then become so much stronger by it. The truth of the matter is that immunity from contracting COVID-19 is not that good. And the majority of people, the immunity wanes, and in fact, there's been many reported cases of people getting the disease again and getting it in a really bad way. So that really wouldn't work for this one. The other is simply one of preoccupation. They put something in the vaccine that we don't know about? Could it have substances that can cause other problems? And that has evolved over the years. And there have been situations in the distant past where things have occurred. Back in the 70s, there was problems with a reaction to the influenza immunization. That was in 76. You guys might recall during the election. And a lot of those things, those kinks have been worked out, and now we know about it, so we can look up to them. There's just far-fetched beliefs that there's toxins or there's any kind of mysterious materials that get put there on purpose. And also the concern that maybe this has been expedited so much, there's so much money into it that, that makes it suspect. Actually, none of the companies are going to make a windfall. They're going to do well, no question, because they've done a great job, but that's not going to be an issue. And then finally is that, little bitty thing in your heart that says, well, I don't want people to tell me what to do. A vaccine is like something they're telling me to do. In this case, I tell you, nobody needs to tell me to do it. I think this is a great opportunity that is given to us, and I'm going to run and get it. And the main reasons, like I said earlier, is such a crapshoot. You don't really know how bad you're going to get this disease. And if you happen to be unlucky and be one of those that developed a cytokine storm or a severe pulmonary insufficiency, your chances of dying are somewhere between 20 and 25 times higher than with influenza. So that's pretty bad.
Mm. Well, you mentioned the great privilege that we have to have access to this vaccine. Who will actually be at the front of the line, and where can folks who might be listening to this expect to be in that line?
Well, that's an excellent question. The tier 1, the top of the line, is going to be individuals that live in a nursing home facility and healthcare providers at nursing home facilities and at hospitals. That totals to about 25 million people in America. And for that reason, that's the first batch coming out is about 25 million doses that have already been ferried across the country in the expectation of approval by the FDA on December the 8th and 9th. So we can expect the vaccine, one of the vaccines, to be available to those people in Tier 1 by December 10th, between 10th and the 14th. And the other, which I can tell you more about here in a second, right around Christmas time.
Okay, excellent. So we'll have our staff that serve in our assisted living and in our health services area. They'll be right up there with the residents who live in those areas in terms of being at the front of the line. Is that what I understand?
That is absolutely correct. And then the second tier will be about everyone else that lives here. Mm-hmm. Older individuals at any place that they live. And of course, that's contingent on getting the doses as quickly as we can.
So talk a little bit about the doses. What I'm hearing, there's more than one, that there is a bit of a delay, and that you may not be fully immune from the point in time that you take the vaccine. Talk us through that process.
That's a very, very analogous to other vaccines that we've taken as kids, right? We get the tetanus and pertussis multiple dose. Those are called boosters. And likewise with MMR and other vaccinations. Same here. Right now, the majority of them, 4 out of 5 of the contenders, are going to be 2 immunizations. The Pfizer and BioNTech, there's a combination Pfizer-BioNTech vaccine, is the one that we're first going to get. That one, you get to have the second dose 3 weeks following the first one. Then the Moderna vaccine is 4 weeks after the first one that you get your booster. So you're going to get some protection probably within 2 weeks of the first immunization, and more robust protection following the second immunization. And again, you might expect a little bit of soreness in your muscles, particularly after that second immunization. And rather than complain, I would just be happy that's my body making a lot of immunity, so there's no chance that I will get this disease. Now, there is one of the companies that's looking at a one-shot vaccine, and that's the Johnson & Johnson vaccine, which is still in the process of being approved, so it'll be a little longer before we have that one.
Now, once I am vaccinated, and do I have the potential of still carrying the virus? Should I continue to wear a mask? You know, what will happen from that point in time that I first take the vaccine and going forward?
Well, that's an excellent question. The vaccine is going to take a little while to work, and what you're going to see is that you could probably still get the disease from other people if you run into those people unprotected shortly after you got the first dose of the vaccine. You probably get a lot lesser severity of disease. And it won't be until probably the second immunization you'll be fully protected. Once you have the immunization, you're probably not going to be able to transmit the disease to anyone because you will not get it altogether. The virus is going to come to your body and your body's going to destroy it as it comes in. Now, as far as others, they'll also be protected from you, of course. And one question that gets asked a lot is, well, if everybody else gets the vaccine, why should I get the vaccine? So the answer to that is not that simple. Really and truly, yes, if everybody else got the vaccine, if every one American except for you, you are protected. But if there's enough people vaccinated and we don't reach what they call a herd immunity through immunization, then there's going to be pockets of disease because nothing is 100%. So the more people get immunized, the more effective it is for everyone.
Can I just wait until I get COVID to get the vaccination? If I'm hesitant about it, talk us through whether or not I could just say, I'm not going to get it. I'm going to wait until I get COVID, then I'm going to get the vaccination, and that's going to help me at that point. What do you say to someone who thinks like that?
Wow, the immunizations of this type are not meant to actually ameliorate or decrease disease or mitigate the disease. They really are meant to prevent the disease. So once you got the disease itself, the immunization is not going to do you any good. So the idea of getting the disease first is a fool's errand. You really don't want to do that. The other thing that has been raised in many circles, as I alluded earlier, is, well, is it better to get the disease? Is that going to make you stronger immunity? Well, this disease, we've had enough cases and sadly enough deaths, over 280,000 deaths, that we've learned a lot about it. And the immunity you obtain from acquiring the disease is actually very feeble. The potent immunity is acquired by the immunization. So no, don't wait to get the disease. Don't wait any time. Interestingly, I'm getting lots of phone calls. I mean, literally 5 or 6 a day to the office of people wanting to get in the front of the line to get the immunization. Younger people say, I don't want to get sick. I don't want to die from this. I'm only 30 years old. And I'm doing the best I can. I'm telling them, well, we need to start where we need to start, which is the nursing facilities and medical staff, and then older people, and eventually it's going to get to you. We're creating a list, but there's a lot of interest. The last few weeks I've seen a turnaround from this concern, unwarranted, but I understand, concern about the process being so fast and the issues that you just raised about, are they cutting corners and so forth, to now more people realizing that this is going to be a lifesaver and you really want to have it. There's a demand now for sure.
So let's shift gears a little bit and talk about folks that may be watching this who maybe even be considering moving into Epworth or in a community like Epworth. What can you say to those folks in terms of the safety of moving now? Should I wait until later? How would you approach it if you had a family member that you were recommending how to deal with this?
Well, actually, I don't have to come up with a story of a family member. I do have a family member, and we just moved her to an assisted living memory care 9 days ago. So that begs the question, why? Why would a doctor, a geriatric medicine specialist do that? because it's much safer for her. Particularly here at Epworth Villa, all the safety measures that I've been taking about access, about interactions within the facility, and the fact that we're constantly updating on a day-by-day basis and adjusting to the positivity rates around the community makes it a lot safer to be here than to be elsewhere. So if you're planning on moving to a long-term care facility, the time is now if the facility has the correct parameters, things like access, safety features for people from the outside. And I understand all the other activities here that I'm sure you can detail a little more for us, Mr. Kelly.
Well, certainly. I mean, we have different levels of care, much of what you refer to in terms of places where we've had some restrictions. That's more in the health services and in the assisted living area. In our independent living area, I mean, we've been wise. We've cut back on the number of gatherings, the people in gatherings, and more recently we've just kind of eliminated those really. As the positivity rate went up, for example, we did cease having communal dining. We are now doing a carry-out only. That's just been within the last couple of weeks, and we'll probably continue to do that as long as the positivity rate remains high. We're looking forward to this vaccination, though. I'll admit it. We believe that it will be a game changer, and it will help not only keep people safe from COVID, but there is a psychosocial well-being that we also are uplifting. We know that as we separate from one another, there is an impact that makes on the person. The emotional and aspect of that is something that we care about. One of our values is to nurture the whole person. So that's in addition to the physical aspect of things. So have you been able to see even the psychosocial impact on people as they've gone through this pandemic?
Oh, absolutely. And that's one reason why being in a community with the degree of safety measures that have been taken here is so helpful. Loneliness has gone up, leaps and bounds during this pandemic. Depression, feelings of not being in communication with people as much, particularly those of us that are less able to do a lot of the technology, and to be at a place where you actually feel that visitors are screened properly and you're not getting exposed like you would be elsewhere. And my understanding, if I get that correctly, is we even have services here at Epworth where people can go do your groceries for you and do a number of those tasks that are higher risk for us living here. And that is just a blessing. But absolutely, I think it's important to continue that daily updating on what's going on in the community and adjusting to that.
Yeah, thanks for mentioning that. We do have those services, and it's not as though residents don't leave. They are certainly, in our independent living area, able to go out and take advantage of whatever services they feel they need to. But we have the option of folks just staying put if they so desire, and oftentimes that is a very common thing that people are doing, especially here in recent weeks when the positivity rate has gone up so high. Well, Dr. Owens, thank you so much for spending some time with us, for sharing your expertise in this area. Is there anything else that I haven't asked that you would like to share with our audience?
Well, just thank the good Lord for those of us that not gotten COVID, that remains safe and healthy. Think of others and use your mask at all times. If you ever have to see a patient, of course, also wear a shield. Go ahead and immunize yourself. I mean, this is such a blessing that is going to be available so quickly, and it's such a wonderful opportunity to prevent this terrible malady. So go ahead and get your shot. You won't regret it.
Well, thank you. Thank you to our audience for checking in with us. And Dr. Owens, thank you very much.
God bless.